Good morning, Tracer Man. I hope you all had a safe and healthy and happy 4th of July. My husband and I celebrated the day by staying indoors and staying out of the heat, which was a good thing for us. Before we begin to talk about today's show, there are a couple of reminders for all of you students out there who will be playing sports this coming year. A current sports physical is required. Physical exams for Warsaw and Lincoln area students will be given on July 12th at the Benton County Health Department here in Warsaw. An appointment and completed paperwork is required before the physical exam can be done. Forms are available at the health department, or you can go online at our website at benton.lphamo.org. Stop by the office or call 660-438-2876 for an appointment. So don't forget, July 12th, sports physicals for all of you playing sports this coming year. Another day to keep in mind is this coming weekend, July 13th and 14th. The Warsaw Rodeo will be back in town and will be the place to be. As you know, the health department has been associated with the rodeo for a number of years, and we try to provide activities for smaller children to promote healthy lifestyles. We'll be back again this year doing some of the same things. We've had stick horse races and we've had some steer roping contests for the little kids. And this year we're going to be adding a couple of games of horseshoes. So it should be kind of a fun time, and it'll get the kids involved in doing some exercises that lead to healthier lifestyles. So grab mom and dad and head on down to the rodeo for this weekend. We'll be there both evenings from about 6:30 to 8, and there's a number of activities going on. You won't want to miss the queen contest and some of those fun things. And of course the mutton busting, the kids love that. So we'll see you there. You won't want to miss these events. Today's show was going to be somewhat of a continuation from last week. Last week, you will remember that we talked about the risk factors of hypertension, better known as high blood pressure. While there are some risk factors that you can't do much about, such as family history, age, gender, or race, there are other risk factors that offer some opportunities for change that can provide a positive effect on your health, such as what you eat, how much you exercise, and your weight. This week's program will focus on a specific type of hypertension, and we'll talk about symptoms and treatment, but also talk a little bit about some of those risk factors that you can't change and what types of changes you might want to do. High blood pressure is serious and can lead to a number of health issues. Pulmonary hypertension is a serious disorder, but the symptoms are vague. It's often misdiagnosed until it's fairly advanced. Pulmonary hypertension is high blood pressure in the vessels that carry blood to and from the lungs. It may be tricky to diagnose because its symptoms resemble those of so many other conditions. The main symptoms of pulmonary hypertension is shortness of breath, doing things that aren't terribly strenuous, such as household chores, climbing stairs, and sometimes just sitting and resting. Usually, it's a gradual thing that progresses over a period of months or years. People with pulmonary hypertension may also have chest pain, some mild, others severe enough that it mimics a heart attack. Other common symptoms of pulmonary hypertension include erratic or irregular heartbeats, such as heart palpitations, especially if they occur with exertion, fatigue, dizziness, swelling of the ankles, legs, or abdomen. These symptoms are often attributed to other things, which is why pulmonary hypertension is often misdiagnosed until it's at a late stage. Doctors frequently distinguish between primary and secondary pulmonary hypertension. The secondary form is most common and occurs in connection with other medical conditions, such as emphysema or congestive heart failure. Primary pulmonary hypertension has no identifiable cause or associated condition. The symptoms are the same for both types. If your doctor thinks that you have pulmonary hypertension, he will take your medical history and perform a physical examination, and then probably some tests on your lung function and capacity. Your doctor may also request a blood test to determine if other conditions often associated with pulmonary hypertension exist. In a thorough evaluation, you may be asked to undergo a sleep study to determine if you have sleep apnea, since sleep apnea often affects blood pressure. Or perhaps you may be asked to take a test where you have to walk for a period of time in order to determine your stamina. These are both tests that will help the doctor determine whether you have pulmonary hypertension. The bottom line is that if you think you have pulmonary hypertension, see your doctor and let him or her perform the appropriate test and recommend appropriate treatment. Don't ignore a shortness of breath. See your doctor. Let's take a break now, Tracer Man, and when we come back, we'll talk a little bit more about what affects the blood pressure readings and why you need to be tested frequently. As we continue talking about high blood pressure, it's important to understand a little more about blood pressure and how it's measured and why. Blood pressure is the force with which blood pushes against artery walls as it flows through your body, the pressure that the blood exerts. Blood pressure is always expressed in two numbers, both measured in millimeters of mercury. The systolic pressure, first or top number, measures the force when your heart beats. The diastolic pressure, which is the second or bottom number, is a measurement of the heart at rest. For example, someone with a systolic reading of 120 and a diastolic reading of 80 would have a blood pressure of 120/80. If systolic pressure goes up, even if the diastolic pressure stays the same, the patient may be at risk for developing serious cardiovascular conditions. Your doctor checks your blood pressure at just about every visit, but why? Because high blood pressure or hypertension increases your chance of heart disease and stroke, and often there are no symptoms of high blood pressure other than the results of your reading at the doctor's office. Checking your blood pressure regularly is a smart thing to do because it does give you some indication of whether your blood pressure is normal or higher levels that may indicate concern. Making a hypertension diagnosis is more involved than performing a simple exam or a blood test. Though hypertension testing isn't difficult or painful, it has to be repeated to make sure that the blood pressure reading is accurately reflecting your usual blood pressure and is not an atypical result. If you have high blood pressure, you want to be sure of your diagnosis and get treatment. So before you head to the doctor for your blood pressure reading, take these steps for the most accurate reading possible. First is to relax. Don't stress about your test. Allow yourself a couple of minutes to sit quietly and relax before the test. Ask your doctor or nurse for extra time if you feel anxious or hurried. Secondly, use the bathroom. A full bladder can lead to an inaccurate blood pressure reading, so make sure to use the bathroom before hypertension testing. Next, don't smoke or drink coffee. Nicotine and caffeine can cause blood pressure levels to increase temporarily, giving you a false reading. Skip the cigarette and avoid that steaming cup of coffee at least 30 minutes before your scheduled appointment. And lastly, get comfortable. Sit in a chair with your feet flat on the floor or lie down while your blood pressure is being read. Sometimes, however, your doctor may ask you to stand to measure a change in blood pressure due to position shifts. Make sure to keep your arm at or above the level of your heart. Don't rest it in your lap. Because it can be very difficult to diagnose the actual cause of secondary hypertension, it's important to work closely with your doctor and pay attention to your own body. If you notice unusual changes like a sudden weight gain or loss, excessive hair growth, or urination issues, it's important to tell your doctor about any new symptoms. In many cases, a change in your diet, losing weight, switching to a new medication, or treating the underlying health condition will get secondary hypertension under control. With secondary hypertension, an underlying condition is generally causing the high blood pressure. Identifying and treating that trigger condition should bring blood pressure down to